Recently, I was talking to a new patient, and while I was taking their history, they mentioned that they had been diagnosed with cellulitis of the leg. Naturally, I asked what had caused it. Was there an injury, a scratch, maybe an insect bite? The patient looked at me a little puzzled, almost surprised that I even asked that question, because to the patient, the term cellulitis itself was the full diagnosis. But for me, cellulitis has always been more of a description rather than a complete explanation, because it tells us what we see on the surface, the redness, swelling, the tenderness, but not why it is happening. And that why is everything. Like many clinicians, I've always thought of cellulitis as redness due to infection. And that sounds simple, but not all redness means infection. Sometimes redness could be just inflammation, or redness could signal a problem with circulation. Sometimes redness is an allergy, and sometimes it's something even more serious, like a blood clot. So in today's video, I'll go over what cellulitis really is, what causes it, how it's treated, and most importantly, I will share with you this one sign that will give you the clue that you are dealing with a truly infectious cellulitis. Welcome back. I am Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends and family, and subscribe. So first, what exactly is cellulitis and what causes it? Cellulitis is an infection involving the skin and the soft tissue underneath, including the dermis and subcutaneous layer. By the way, any part of the body can develop cellulitis, but it most often appears on the lower legs, particularly around the ankles and shins, and less commonly on the arms, face, or anywhere that the skin has a cut or irritation. And that is the key. It usually begins when bacteria find a way in through a small break in the skin. And it's very important to note that skin breakage or skin compromise is usually the first step. It's like a doorway to bacteria. Those skin injuries could be from small cuts or insect bites, or let's say cracked or dry skin that was initially due to eczema, or let's say if you have fungal infections that get worse. And what happens next is that the skin breaks and gets secondarily infected by bacteria, leading to a superimposed bacterial infection. And another big cause of infection is the presence of surgical wounds or trauma. They could act as great breeding ground for bacteria. The most common bacteria are Streptococcus and Staphylococcus aureus. And I have to say that usually they live harmlessly on the surface of our skin, and having staph and strep on the skin is normal. But once they slip underneath, they can multiply quickly and turn from colonization to a full-blown infection. And that, of course, is much more dangerous in case of MRSA, a methicillin-resistant Staph aureus. So what happens is that's when our body actually reacts. Blood vessels in that area open up, flooding the tissue with oxygen and immune cells, and you see redness, swelling, tenderness, and warmth, all signs of your immune system fighting back. And it's a microscopic battle happening under the skin. People with diabetes, poor circulation, obesity, or weakened immunity are more prone to cellulitis. So the infection begins locally, but if untreated, it can spread up and down on the limb or whatever the affected area is, and it can spread deeper, and it can even get into the bloodstream. So now let's look at the situations wherein it's not cellulitis. And here is where things can get confusing, because redness doesn't always mean infection. So you can have redness from eczema. That's inflammation, not infection. In eczema, the skin barrier weakens, moisture escapes, and irritants enter. The skin becomes dry, flaky, and itchy. So if you look closely, you'll often see tiny bumps or scaling. And the key word in eczema is itching, not pain, not swelling, although sometimes you can see that too. You can also see redness from venous stasis or poor circulation in the legs. Venous stasis is when your veins don't function normally. So it is an issue of incompetent veins. When blood pools in the lower legs, the skin can look shiny, red, and tight, especially around the ankles. It may even darken or develop sores over time. And this is usually a chronic condition that has a redness component. But it's not a cellulitis per se. Venous stasis could turn into cellulitis, and venous stasis ulcers could get infected. And in that case, you have both venous stasis and cellulitis. But in its pure and early stage, venous stasis is not an infected redness. Then there are allergic reactions. An allergic rash can appear suddenly and look bright, red, and itch intensely. It often has a very clear outline, like under a bracelet or where a cream touched the skin, that irritating cream, and it's caused by histamine, not bacteria. And when you touch it, it usually itches as well. And finally, we have DVT, deep vein thrombosis, and that's a blood clot, often in the calf, which can also make the leg red, swollen, and painful. The redness here tends to be deeper, and the swelling is often more uniform. A DVT can be warm sometimes, but the real cause here is internal. It's inside the vein, not in the skin. And missing DVT can be dangerous because the clot can travel up and it can unfortunately cause pulmonary embolus. Sometimes with DVT, you could get cellulitis. So DVT and cellulitis can coexist, each worsening the other. So to summarize these observations about redness, we can say that redness alone isn't enough. Swelling alone isn't enough. Pain alone isn't enough. Itching often is not relevant. However, there is one sign that helps us tell when it's truly infectious. So the one sign that distinguishes infection from non-infection is worms. And one time I said that in front of the patient, and the patient thought that I was talking about parasites. So no, I'm talking about worms. I'm talking about heat. So when you gently place your hand over the skin and feel that deep radiating heat, that's the clue that your body is fighting bacteria underneath. This worms happens because blood vessels expand, immune cells flood the area, and the local temperature rises. It's your immune system creating a mini fever in one spot. Redness can come from irritation, swelling can come from fluid, pain can come from pressure, but worms, that unmistakable heat, points to infection. And it's the one sign that says this isn't just inflammation. This is an active battle. If the skin looks red but feels cool, it may be circulation or an allergy. If it feels hot, especially with swelling and tenderness, that's cellulitis. So how cellulitis is treated? Treatment depends on severity. For mild cellulitis, oral antibiotics such as cephalexin usually work well. If MRSA is suspected, doxycycline or Bactrim, they may be prescribed. Severe cases, those with fever, spreading redness, or deep pain, often require IV antibiotics and sometimes hospitalization. During an active infection, topical creams or compresses are not recommended. They don't help the infection and actually can delay proper care. Treatment should target bacteria from within. The main supportive measure is elevation of the affected limb, which helps reduce swelling and improve blood flow while antibiotics actually do the work. After the infection resolves, focus shifts to prevention, keeping the skin healthy, hydrated, and intact. So chronic moisturizing could be a small measure of prevention for people with eczema who are prone to cracked skin and bleeding skin, let's say in the winter. Or, for example, taking care of chronic fungal infection, that is also a small sign of or small act of prevention. So basically, the goal should be to keep your skin barrier intact. My final point is something that everybody needs to know. When cellulitis becomes dangerous, most cases heal well with timely antibiotics, but when cellulitis is missed, especially in people with diabetes or suppressed immune system, the bacteria can spread up and down the body, and it can spread deeper, and then it can enter bloodstream and lead to sepsis. Sepsis is a life-threatening infection of the entire body, and yes, people can lose lives from cellulitis that wasn't recognized or treated in time. And that's why noticing that one sign, worms, and not ignoring it can make all the difference. It can be the clue that saves a limb or even a life. So next time you notice redness on your skin, don't just look at it, touch it with clean hands, of course. And if it is consistently warm, that's your body's way of saying that there's infection brewing underneath. Cellulitis can spread quickly, but when treated early, it responds beautifully. Understanding that warmth, that difference between inflammation and infection, helps protect your health and, in serious cases, even your life. And of course, always seek medical attention. Don't postpone that. Thank you so much for watching. I'm looking forward to reading your comments. Please like, share, subscribe. Until next time. Bye-bye.